and make our planet a much better place to live.
Did you know the City of Corpus Christi has an online self-service center? The online self-service center connects you to the City of Corpus Christi's customer call center for the fastest response times. Submit a service request, send the city a question, report a violation, check the status of requests and complaints, search for city permit forms, and access other online services. Visit cctexas.com and search Online Self-Service Center. It's a quick and easy way to connect to the city.
Everybody, we're going to begin our specially called press briefing. This is a joint city-county health press briefing. And we've been at this for about 10 months, right? Is it going on 11? 10 or 11 months, but we have new information today on a new strain of coronavirus that's made its way into Nueces County. And we want to share that with the community. And before I continue, though, I do want to thank the media for showing up at such short notice. And I think that the city and the county leaders have done an outstanding job in connecting with the community and communicating with the community over these 10 months on the pandemic, but we wouldn't be as successful if it wasn't for the media. And so we want to thank you all for helping us educate the community, helping us keep the community safe and saving lives. A lot of that is due to you all, the media. So we thank you for your continued vigilance and helping to educate the community, and we especially thank you for being here this afternoon. So I'm just doing some introductory remarks. With us this afternoon includes Mayor Joe McComb, and he's going to speak next. Nueces County Judge Barbara Canales is here as well. Our local public health authority, Dr. Ramachandruni, who you all know, will speak as well this afternoon. And then the City County Health Director, Annette Rodriguez, will close out the briefing. And so this briefing is on a new strain of coronavirus that you all probably have heard of by now. It's originated in the United Kingdom. Its technical name is B117. And we'll hear a little bit today about why it's critical we were aware of this strain of virus. We're going to hear about how does a vaccine that several thousand now have received in the county, what does that mean to the vaccine that we have? Dr. Ramachandruni is going to have a phone call tomorrow with the Center for Disease Control, and he'll learn more information tomorrow. And so we will be back in front of the community to share that information once he learns it. Today we were notified by the State Health Services Department that we had that strain identified here in Nueces County, and specifically within the city limits of Corpus Christi. So I'm going to turn it over to Mayor Joe McComb, who's going to say a few words, and then he will be followed by Nueces County Judge Barbara Canales.
El día de hoy invocamos una conferencia especial debido a un caso nuevo por el coronavirus. Ya son 10 los meses que hemos llevado a cabo estas conferencias. Le quiero agradecer a los medios en sus transmisiones para así tener a la población informada. Más adelante, los detalles del caso por esta cepa nueva, primero que se dio a conocer en el mes de septiembre en el Reino Unido.
Well, thank you. I'll be brief. The main purpose wanting us to be here today is to show you that it's continually a team effort on keeping you informed and the transparency of providing as much information as we can, as quickly as we can about this new strain as well as our current strain of COVID, and to let the community know that we're not backing down from fighting this thing. We're working together as a team. And I can't express enough my appreciation, as Peter did, to the media for getting the information out as quickly as possible. And again, to Judge Canales and all the medical people. As you can tell, it's a Sunday afternoon. This stuff doesn't rest and it doesn't stop. And so we're going to have to continue the fight and just show them that, show that vaccine that we're going to win. But they've got a fight on their hands if they're going to think they're going to knock us out. So again, just thank you for being here. The weather is not the best to be out in, but you as the media, you get called in all kinds of weather too, and all kinds of circumstances. So working together with our team, we'll continue to provide this information for you. Just remember, I know it gets old, but repetition is the best lesson. Continue to wash your hands, wear your mask, take care of yourself, avoid crowds as much as you can. And the more we learn as quickly as we do, we'll continue to keep you informed. Judge Canales is coming down, and then we'll have some comments, and then we'll hear from the medical professionals. So stay safe, stay warm, and stay healthy.
Continuamos trabajando en equipo para así combatir este virus y seguiremos combatiéndolo hasta ganar. Gracias por acompañarnos. Le queremos recordar que continúe lavándose sus manos seguido, utilice su cubrebocas y mantenga su distancia. A continuación, la juez del condado, Bárbara Canales, nos va a dar un reporte.
Good afternoon, Barbara Canales, Nueces County Judge. I just told the mayor he had the best talking points. They look just like the ones I've just reminded myself. I'm going to basically re-emphasize what I think is going to be the most important thing, and that is that because we are still learning new things about this virus, and as it creates variants of itself, we do need to stay informed. That's why we're having this press conference, and it's why we've made a commitment over the weekend to work solidly to beef up our information pieces with regards to vaccine registration and our websites, which are mirror images. So we don't want you to have one piece of information on the city's website that would be look or feel different on the county's website. So I just want to say thank you to those PIOs, public information officers, and specialists in communications. It's going to make it better for all of us when we have up-to-date information. I also agree that staying healthy is going to be the most important aspect of fighting whether it's this virus or this variant. One of the things about the variant, and I'm going to defer to the medical experts in the room, but what we have known for a while since its first reporting in England is that it becomes more contagious, right? So it's yet to be seen whether it's more virulent, but we know it's more contagious. Therefore, the next piece of my point, I've got these 3 points today, is definitely to stay safe. Really, this is not a time to take unnecessary risks. When you look at the community risk dashboard today that we've created and we launched last Friday, when I spoke to you, I believe on, I guess it was Tuesday, it was orange. But I said it kind of looked like it was hot orange. Well, I looked this morning and it's red. What does red mean? Red means that we have a tremendous risk in our community. And so those 3 issues of stay informed, stay healthy, and stay safe could not be more important. What is our responsibility to you, the citizens, at this moment? Pretty simple. We're going to get more and more resources. We're going to focus on resources. Resources include testing and vaccination and supporting logistics. I think that you're going to see an incredible operation starting this week that will carry on through the rest of the week. I also think we're going to see some challenges, and I want to warn you now about those. Some of them are completely out of our control. Some of them will be in our control, and we will be pivoting or changing or flexing, whatever you want to call it, just like a hospital will do when they find themselves in a pinch. So please look for us to be strong on resources and stronger on logistics. We're going to stay ahead of the trends. That's what this is about. It's staying ahead of the information that we first heard probably, just 3 hours ago. So as we get it, we stop what we're doing and we come to make this informed announcement. So I would just ask that we stay very tuned in to all of the ways that we like to receive information, that you continue to share with us what you like and what you think needs to be beefed up as far as you getting accurate information. And I specifically want to say that our county has, as its local health authority, Dr. Amash Kharduni, as an infectious disease specialist. So this is his game. This is what he does for a living. It is what he understands. So not only are we very blessed with a very strong and robust health department and a very savvy and experienced sorry to date you, Annette, but I'm right there with you, girl, 30 years of experience in public health. But we have a local health authority whose profession it is in infectious disease. So when he speaks with the CDC about this variant, he's speaking with his colleagues, people who are in the same arena. So I just want you to know that Nueces County is very prepared to handle, quite frankly, any pebble that comes in our road. And this is one of them, but it is not insurmountable. So let's listen to some of the public health experts at this time. And of course, we always remain available to you throughout the week. We do want to invite the media to our media tent, which will be held at the Keach Library starting tomorrow at 10 a.m., and we will be there till 5 p.m. We can take interviews there, your questions, and we will be able to escort the media at the proper time over to the vaccination site. So as a reminder, if you have concerns or questions about your access, please contact either the city or the county communications department. Thank you.
Quiero enfatizar que seguimos aprendiendo de este virus. Es importante que esté informado y continúe estando informado. Nuestra información está en nuestro portal de Internet. Sabemos que esta nueva cepa es más contagiosa que la actual, por lo que le pido no correr riesgos. Aún no sabemos si va a ser más letal hasta que aprendamos más sobre este virus. Mientras seguiremos buscando por más recursos, vamos a contar con muchos retos, algunos fuera de nuestro control. Vamos a hacer lo posible por estar al tanto lo más pronto posible, por lo que le pedimos que sea vigilante. Nuestra autoridad de salud, el Dr. Ramachandruni, cuenta con toda la experiencia y su profesión como especialista en infecciones. Estará él en contacto con el CDC y nos dará toda la información más pertinente. El día de mañana tendremos la clínica móvil. Si tiene alguna pregunta, puede comunicarse al Departamento del Condado de Nueces al 826-7200, al Distrito de Salud.
Oh, thank you. Thank you, everyone. We have an important announcement from Nueces County Health District. So the Corpus Christi, Nueces County Public Health District, we received a notification from the Texas Department of State about a Nueces County resident diagnosed with a B117 coronavirus variant, which is a new mutant virus that was found in the United Kingdom and also has been found in 8 US states and also in more than 33 countries around the globe. Currently, there is no evidence that B117 causes more illness, severe illness, causes more severe illness, or increased risk of death, according to the CDC. So the information we have about this resident, he's a male between 60 and 70 years of age. He recently traveled to United Kingdom, where he believes he contracted the disease. The individual is currently recovering at home. What I was told, his symptoms were having severe headache, and he's currently recovering, which is good news. And the individual will be kept in isolation until he is released by me to further spread of this new variant in the Nueces County. So far, studies on all new coronavirus variants are ongoing, and early data seem to suggest this current COVID-19 vaccine would be able to protect against this variant. But more studies are needed. Therefore, it is crucial everyone receives the COVID-19 vaccine as soon as possible, as they qualify under various phases. Current phases of vaccination eligibility are Phase 1A and Phase 1B. And it is important that everyone continue doing their part by following the public health prevention recommendation, by following the 3 Ws, as the mayor and the judge just suggested. Wear a mask, watch your distance, and wash your hands as often as possible. So just a few things about this virus. Why is this so important that we should know about this virus? It is known to be more contagious and can cause increase in infectivity rate by 60 to 80%. So the recent UK surge was attributed to be because of this virus. And fortunately, this new strain can be detected by our current testing, which is the rapid antigen and PCR. So the mutations did not affect the genomic sequence that we test against to find the virus presence. So we'll have more information after we have a call with CDC tomorrow. So the 3 takeaway points based on the current evidence: 1, this does not cause severe illness. Number 2, this does not cause increased risk of death. Number 3, it does not affect the efficacy of the vaccination. So, but we know as it is, the COVID illness is out of control again, causing increasing hospitalizations. So I want everyone to understand, in order to develop the immunity to the virus, we only have 2 options. 1, getting infected or getting vaccinated. I believe the second option is the brightest. So as you, with a sense of urgency, I urge clinics and institutions who have the vaccine to vaccinate people, and also people to come forward to get vaccinated. Thank you.
El Distrito de Salud recibió la notificación de un paciente con el virus B117, que es la nueva cepa del coronavirus encontrada en el Reino Unido. Aún no tenemos información si es más letal, pero no se cree que lo sea. El paciente se encuentra en su residencia recuperándose. Él es un hombre de entre 60 a 70 años, quien recientemente viajó al Reino Unido y se cree que ahí se contagió. La vacuna que actualmente se administra podrá prevenir esta nueva cepa. El día de mañana voy a tener una llamada con los CDC para poder discutir sobre este incidente. Se cree que esta cepa no causa mayores problemas a los que actualmente causa el coronavirus, no es más letal y no afecta la eficacia de las vacunas actuales.
Annette Rodriguez, Public Health Director. So we always tell you that when we have information that is pertinent to the public, we're going to give you that information. And so today that information was really important that we, even on a Sunday afternoon, got together to make sure that you were informed. Every decision that you make from here on out, you need to make sure that you're calculating the risk and the benefits for actually picking up coronavirus. So we know that there's 7 states that actually have this variant B117 that we're talking about. One is Colorado, California, New York, Pennsylvania, Georgia, Florida, and Texas. In Texas, there's been one report of the variant B117, and with this one today, there will be 2 now. So again, make those decisions when you're deciding where to go. We also know that the individual that went to the UK, because they actually felt like they picked it up in the UK because that's where they got sick before traveling back, but they had to go. So it was a family emergency, they had to go, and so they went knowing that there is a variant strain in the United Kingdom. So the individual has been very good about isolating themselves, making sure not to transmit it to anybody else, and so that actually makes us feel better about this. We are going to, as was mentioned, we will have a CDC call hopefully tomorrow morning and learn more about what the expectations are from CDC for us on this one individual. So we stand available for questions at this time, if you have any.
Le habíamos prometido mantenerlo informado cada vez que tuviéramos información pertinente vinculada al virus. Son 7 los estados en la nación que han reportado casos con esta variante, 2 de esos casos en el estado de Texas. El paciente se encuentra aislado y tuvo que salir del país de emergencia, por lo que se dirigió hacia el Reino Unido.
Okay, great. I'm just going to close out the briefing, and then we'll get some questions if the media has some. So I think what we heard Dr. Ramachandruni say is the biggest problem with this variant is that it's more contagious, right? So it doesn't necessarily make you any sicker, although coronavirus can kill, right? So it can make you as sick as the prior strain, but this one's more contagious, and we know that's a bad thing for a community, that rapid spread. And then tomorrow Dr. Ramachandruni will be talking with the Center for Disease Control, and so we'll provide more information to the community once that conversation takes place. I did want to just close out by reminding everybody, the judge talked about it and a few of us talked about it, just to make sure, and since the media is here, tomorrow the city-county will begin a massive vaccination drive. The state has allocated 4,000 vaccines to Nueces County, Corpus Christi, and they're meant not only for our county but for the region. So the city-county providers will be a regional hub for the coastal bend, just so the community knows that. So tomorrow, Monday, we're going to vaccinate about 500 persons, maybe a little more than that, depending on how things go. Tuesday, Wednesday, Thursday, another 1,000 persons will be vaccinated each of those 3 days, at least, so maybe a little bit more each of those 3 days. Today, in about 40 minutes or so, the 5 o'clock online registration will open up for the drive tomorrow, and we're going to pre-register 250 individuals. And so, as the judge said, you can imagine with a community of over 300,000 people, that 250 is going to go quick. Just have patience with with the whole process. We're reliant on the state and the federal government to get those vaccines. We have a great distribution network in place, and we're working as hard as we can, but we can only give out what we receive. And so the 250 Pre-registered will go quick, but that opens up at 5, and you can go to the city-county website, coronavirus website, to get that form to online register. That address is www.cctexas.com/coronavirus. Once you go there, you're going to see a form kind of scroll down towards the bottom of the page. And then tonight, beginning at 5 p.m., the first 250 people will populate that form. You do need to get a QR code to be able to go through the pre-registered line tomorrow. However, tomorrow we're also going to take 250 people and we'll register them on site. So tomorrow, a total of up to or at least 500 people tomorrow. And tomorrow's drive will begin at noon. And tomorrow's Monday, Tuesday, Wednesdays, all these mass mega drives, at least for right now, will be at the Richard M. Borchard Fairgrounds. And that is up at 1213 Terry Shampsey Boulevard in Robstown, Texas, in Nueces County. It's a county facility. And so the city-county medical team will be there. We've already done about 500 persons through that drive-through situation when we've received our first dosages from the state. So the process is well rehearsed, it's well run. We've heard nothing but positive comments from the community on it. And we look forward to tomorrow to bringing in 500 additional persons, and then Monday, at least Tuesday, at least 1,000, Wednesday, another 1,000, and Thursday as well. So pre-register today at 5. Every day at 5 o'clock is when our pre-registration will open up for the following day. Okay, so today after it fills up, you won't be able to, you'll see it, but you're not going to be able to get the form because it's full. Tomorrow, go back at 5 o'clock and you can pre-register for Tuesday. Tuesday at 5, you can pre-register for Wednesday and so on. So tomorrow, we can pre-register 500 people, whereas today we're going to do 250. Okay, and then the 4,000 doses that we received, we expect that to continue. Annette Rodriguez has a great team, and one of the things she knows is that we expedite the delivery of those vaccines. We get rid of them quickly, and what that means is we get more. So the state's looking for those providers that can move the vaccine. Those providers that can, like the City County Health District, that means we're going to get more. So we'll get 4,000 this week. We already have confirmation they're coming in at 10:30 tomorrow, and we'll be shipping them to Robstown for that noon start. But next week we expect another 4,000 at least, and the number will probably get bigger and bigger as time progresses. And again, we're considered a regional hub, so you do not have to be for tomorrow's event, the next couple of days, next couple of weeks. You do not have to be a Nueces County resident. We're accepting residents from the Coastal Bend region because we're considered the regional provider. Okay, so that concludes our press briefing. We do have our medical experts here, the judge, the mayor, and Annette. And so if there's any questions from the media, we'll be glad to take them at this time. Okay. Yeah.
Yes.
Do we know if this person went to any stores or restaurants once they touched down here in Nueces County?
He's been quarantining himself, so he's pretty good about it. So we believe that he hasn't gone and been in contact with anyone.
Right. And was it 7 or 8 states in the entire U.S. that has this new strain of COVID-19? Because I think you said 8, but Annette said 7.
You're right. It says 8 U.S. states here. I believe it's 8. Yeah,
okay.
So,
that's it.
Yeah. She only typed it, so.
Yes, I'll just, you can probably go back. I guess I just want to clarify, this was, once again, a male between his 60s and 70s. Is that correct?
Yes.
And I suppose I would just move that to this, if we're looking at it from a date perspective, it seems like this might have been happening during the new year. I know Ms. Rodriguez has specifically, spoken. I've heard situations of, families out in El Paso coming and bringing the entire strain, and not the new strain, but just COVID altogether. What does it mean to know that, we're having international travel at this point, even though you guys have just kind of continually been trying to set in that that's something that Nueces County residents should not be doing?
Well, right now we don't have any travel restrictions, so it's just that everybody has to use their, knowledge based on the risk of transmission and take it from there.
Understood. And that,
Yeah.
I believe you had said that this is within the city limits of Corpus Christi, correct?
Well, this person lives in the city.
Understood.
Yes.
Okay. And I have one other thing here. Let's see. You mentioned that this person was recovering. However, I was just trying to see. Goodness. The city limits, B117. No, I apologize. That person is said to be self-quarantining. Do we know if there's any other extra steps that this person needs to take? I know you said it's more contagious. Is, from your knowledge, mask wearing going to be enough? Or do you want people who, test positive for this to completely self-quarantine for maybe even a longer period?
Yes, I mean, this is a new variant, and obviously we'll get more information from CDC tomorrow based on when we should release him out of quarantine. So a couple of thoughts is maybe we should test him again to make sure he's negative, at least like we used to do in the beginning. Maybe test him like 24 hours apart, make sure he's tested negative twice, and then go from there.
I believe the first case within Texas was in Harris County. Did you guys say this is the second case within the state of Texas here?
As far as I understand, yes.
Okay. Thank you very much.
Thank you.
I'm sorry, I have one more question.
Sure.
When did this person get back to Nueces County?
29th, I believe, not 29th and 31st, so
29th or the 31st?
around that, yeah.
Okay, all right, awesome.
Yeah.
Thank you.
All right, thank you.
Okay, any other questions from the media? Okay, great. Well, again, we want to thank the media for being here and for helping us carry this public message out to Nueces County and beyond. We will be in front of the media again tomorrow if it warrants with Dr. Ramachandruni. And then just a reminder, Tuesday is our normal press briefing at 5 o'clock in the afternoon, and we'll be here to provide additional information. We'll talk to everybody later. Be safe and remember those protocols. Thank you.